All right, let us go ahead. Good afternoon, everybody. Welcome and thank you for attending today's IPHA Third Thursday Lunch and Learn web series bonus session. My name is Anjali Deshpande, and I am an associate professor of epidemiology at the College of Public Health at the University of Iowa, and I'm also IPHA's president-elect. We have a great Lunch and Learn season planned, so we hope to see you each month for our Lunch and Learn series that actually officially starts in September. This session is being recorded and we will be posting it to the IPHA YouTube channel. Just a couple housekeeping items before we get started. Your microphone should be muted during the presentation. This makes sure that everybody can see and hear the presenters during the session. As we go, feel free to put any questions that you might have into the chat or the Q&A features of Zoom. We have a packed hour, but we hope that there will be some time at the end for some questions and live discussion. So we'll follow up there. All right, let me just check here. Okay, great. So some of you may be familiar with a session that we did earlier this year in April to celebrate the first day of National Public Health Week. And the theme of that day was civic engagement. So at IPHA, we have grown increasingly interested in civic engagement, civic participation, and the role that these things play in health. So today's topic is a very specific aspect of civic participation, particularly voting and health. And I think we're all pretty familiar with the idea that all policy is health policy. So we're going to have the opportunity to talk about that a little bit more. Let's see. All right. It was also important for us today to have this bonus session today because August is Civic Health Month. So when better to talk about the role of civic engagement and health, and to think about the idea that health is always on the ballot. This might come as a surprise. I mean this facetiously, of course, but it might come as a surprise that 2024 is an election year. There is a lot on the ballot this particular year, and we need to be prepared for November 5th. So our session today is focused on civic health. The other message that I want to send out, and you'll see more about this in the future as well, is that September 17th is a National Voter Registration Day. So at the end of our session, we have a couple call to actions that we're going to share with you, and we'll come back to this idea of National Voter Registration Day toward the end. I have this slide just to remind us that there are many different types of civic engagement and civic participation. Today, as I said, we're going to be talking specifically about voting as one of these pieces, but there are a lot of other things as well, from advocacy to volunteerism to service learning, social programs, and so on. And so, as I said, this is a growing area of interest for us at IPHA. You'll hear more about these different kinds of things throughout the next year, year and a half, and we'll be talking about lots of ways that we can be involved in our communities. I want to point out that Healthy People 2030 has an objective around voting to increase the proportion of voting age citizens who vote. This is data for the United States, and I'll just point out that for Iowa in 2022, the total voter turnout was in the range of, I believe, around 55%. And in 2020, at our last presidential election year, it was around 75%. So Iowa is doing well when it comes to voter turnout, but there's room for improvement. So we'll have the opportunity to talk more about that. We have two wonderful speakers joining us today, and I'll just very briefly introduce them to you, and then they can each kind of take an opportunity during their time to tell you more about themselves. But Jeanne Ayers is the Executive Director for Healthy Democracy, Healthy People, and she's joining us from the great state of Minnesota. Shannon Brisbois is the Director of Strategic Community Partnerships, and she is with Vision Leads right here in Iowa. So they're going to share their work and their experience with us. Let me stop sharing and pull up your slides, Jeanne. Okay, excellent. Welcome.
Thank you. I'm so excited to be here with you and the Iowa Public Health Association. First slide, I'll share a little of my own story. I am actually fourth generation from a farm in central Minnesota. And what I didn't realize when I was growing up was what a rich civic health experience I had. Or how maybe not everyone has that experience, but what being in that environment and knowing that we had to figure out with our neighbors and with the people who lived there how we were going to do things and how we were going to create the conditions to thrive was just a normal part of my growing up experience. And next slide. It actually, now the county health rankings and others, and you have just referenced civic, it is civic health. It's the cornerstone actually of democracy. It's when people and places can thrive when everyone participates. And the opportunity, it brings hope and belonging, and also the expectation of sort of shared responsibility. I have one democracy story to tell about that environment. So in the Dust Bowl, following the Dust Bowl, people came together and together got the federal government. So this is a relationship between government and policy making and conditions for health. But they came together and got the government, the federal government, to make investments in tree farms at the state level. So the state then developed tree farms so that they could grow the trees that we could then use as farmers to plant windrows to stop the blowing and the erosion of the soil. And then the county government came together to purchase planting equipment. And then farmers themselves and the farm families went from farm to farm to farm throughout our whole county to plant the windrows that you now see when you drive through these kinds of communities. So that's an example of the kind of civic participation and engagement and decision making and mutual investment in our future that I had an opportunity to be part of. I am currently the executive director for Healthy Democracy, Healthy People, but I previously was the state health officer in Wisconsin. And before that, I spent 8 years as the Assistant Commissioner of Health and Chief Health Equity Strategist in Minnesota. This experience of democracy that I had, next slide, actually led me into public health. I think public health is what we do collectively to assure the conditions in which all people can be healthy. And that just felt like the kind of work that I wanted to do. And I've been energized by that all along through my work career. But in 2020, we came together and created an organization called Healthy Democracy, Healthy People. And our purpose is to build our collective influence and power to realize health and racial equity by strengthening democracy through inclusive civic and voter participation. Next slide. 11 national public health organizations came together, and this was in 2020. I was in Wisconsin for the first 5 months of the pandemic, but then came and said we really needed to be sure that the public health organizations came out strongly promoting voting and not coming out and saying, if you have a risk factor, don't go. And we wanted to be sure to make that link between inclusive voting and health outcomes. And so these national public health organizations came together. It's about, that represents your overarching APHA, along with, so there's about 17 or 1,800 institutional members and 55,000 or so individual members in this coalition. We use, next slide, we use 3 practices to build our collective influence. One, we organize ourselves and our organizations, so that coalition, and then we build bridges with other kinds of civic engagement and health groups. And the second practice is organizing policies and resources. Anjali mentioned the Healthy People 2030 objective. We helped organize our coalition in order to advocate for inclusion of that objective into Healthy People 2030. And that became a new core objective in 2023. And we organized the research and the data and the narrative. And I'll talk a little bit more about that because it gets to telling the story. Next slide, and then the slide after that too. It comes to telling the story about how is democracy really related to health. And this goes to this is the social determinants of health. This is what we've been talking about for 30 years. We say these are the conditions that are necessary for health. And they're all these social determinants, all these policy environments, but also in this list is inclusion, social cohesion, and healthy governance. And we've been using this framework for a long time in public health, but something was missing for me. And next slide helped me kind of get more clear about it. So it's clear that our health is almost completely connected to our living conditions. And as public health people, we know food and housing and the overall environment, these are also important. But there's a whole nother component, which is the capacity to act on those living conditions, the capacity to influence the policies that create the conditions, so that we create the conditions through our collective power or our lack of power. So by participating or not participating in civic life and politics, we play a role in choosing who will thrive and who won't thrive. Next slide. And representation in policymaking spaces matters. So when we have representation, the people who are represented create communities of opportunity, and that leads to better health outcomes. And low opportunity communities are influenced by having less influence, and we create those community conditions as well, which leads to worse health outcomes. So again, also in our practice, we've spent a fair amount of time talking about health disparities and trying to impact health disparities. But this is sort of that through line where representation in the decision-making spaces matters. Next slide. So to summarize sort of our understanding, the coalition's understanding is that higher civic and voter participation leads to greater power to influence the policy environment, which leads to better health outcomes. That's a virtuous circle, but it goes backwards too. So less influence, less power, less influence, less participation. It's a circle that can go either way. And so one of the things that we've seen is that it's important for us to be able to tell the story. So in 2020, we began to tell the story about inclusion and health outcomes, really looking at international and historical data. Next slide. So we've seen, whenever we've expanded the electorate, an improvement in health outcomes. So after the women's suffrage, the 19th Amendment was passed, and maternal child health investments and began to be prioritized, and child mortality rates declined by 8 to 15%. In the 20th century, the civil rights movement ushered in policies in more education access, housing, economic opportunities, and as well as Medicare and Medicaid. And again, there was an improvement in health outcomes. And in fact, the Voting Rights Act led to reductions in Black infant deaths in those counties that were subject to pre-clearance. And pre-clearance is when they had to have their voting rules reviewed for their disparate impacts on people before they could move forward on them. That's the vote. That part of pre-clearance has been struck down in the Shelby decision as recently as 2013. So we're seeing some backsliding in that. And then in 2010, with the passage of the ACA, people were organizing to expand Medicaid. When we were telling this story in 2020, we had that international data that showed wherever we had healthier and more inclusive democracies and higher voter participation, we had better health, and we had this data. And but there's 2 points I want to make. One is it has always been contested. There's no like just forward momentum. Every time there's an increase in movement forward, there's a pushback. And so we see this sort of continuous struggle for power, which I think many of us have experienced and are experiencing in the last decade and or so. So next slide. So one of the things that we did was in 2020, we had historic turnout across every single demographic in this country. Every single population voted at a higher level than they had voted before. And just remember 2020, we didn't have vaccines. We were all in our houses. There were a lot of things that made that pretty special. First, people began to be aware of the ways they could vote. And people, I think, felt like there was a call to action that we could do something collectively when we were so isolated. So anyway, it was pretty cool. We had this huge turnout, and we also were tracking it, and we had no COVID outbreaks related to the election. So in late 2020, we should have been celebrating that. But what happened was there was a pushback, that continuous struggle that I referenced, that then began to reform the narrative that, well, how could you have that turnout? It must be fraud. It must be something wrong. So whenever you organize data and narrative into a story, it helps create the potential, or it creates the pathway for policy implementation. And so that's been happening, and we can talk more about that. But one of the things that we felt that we could do as public health organizations at that moment in time is something that we're always supposed to be doing, which is tell the bigger story about what creates health, tell the truth about what creates health. So we launched an effort to create the Health and Democracy Index, which is, again, a narrative. When I mention those practices, it's a narrative organizing strategy, and it compares 12 public health indicators and voter turnout to the ease or difficulty of voting in each of the 50 states. So it compares not just voter turnout and individual action, it compares the policy environment in each of those 50 states, and then the health outcomes, and does that analysis. And what we discovered was a very clear pattern that where states have more voting access and greater civic participation, they have better health outcomes. Next slide. And this is a kind of fun site to go look at. It's all, you can search on all these things. I put a star on Iowa for you so that you can find yourself. But each of those boxes is a state. And on the vertical axis, you see better health or worse health. And on the voting, on the horizontal axis, you see less and more voting access. And you know, we used the public health indicators that we often use. Next slide. You can search this site and look by every metric. You can look at self-reported health or infant mortality, or poor mental health days. So there's 12 of those altogether. And or you can look at it by policy environment. But what you see when you do those searches and you click on them is the pattern keeps staying the same. And when we talk about creating system change, you have to look at the pattern. So next slide. So when we talk about inclusive voting policies, these are the kinds of things that we talk that are included in that analysis. Policies that expand voter access, that make it easier for an inclusive representative democracy. No excuse mail and early voting. Inclusive voter registration programs, including automatic voter registration. online, same-day voter registration, enabling voter registration and education in service settings, non-strict voter ID, and reinstatement of voting rights for people who have completed any criminal justice punishment. So those are the kinds of policies that are in this, included in this analysis. Next slide. So again, we did some additional research, and partners and groups have done additional research since this. We came out in 2021 with the initial analysis that is included in the index. And since then, there's been more things reported. States, a study that shows that looks back from 96 through 2020, showing that better rates of state level self-reported health across time, where it's easier to vote, and lower uninsured rates where it's easier to vote. Counties in states where it was easier to vote had lower pre-vaccine COVID case and mortality rates. Southern counties that had the voting rights protections that we had mentioned, that I mentioned earlier, had significant reductions in Black infant deaths right after the Voter Rights Act. So that was a recent study that shows as well. And here's a point that was helpful in some policymaking spaces, is that actually civic engagement among adolescents and young adults is positively associated with better future income, education levels, and mental health compared to non-voters. So, you know, depending on where you're working and what you're doing, and people are worried about the mental health of our young people, civic engagement is a pathway to better mental health and better life outcomes. So next slide. We recognize that this has been a constant struggle, and I mentioned it a couple of times. Next slide. Just looking again in that historic turnout in 2020, 33% of our eligible voter population didn't vote. So that is not a healthy voting rate when you look at what other countries have been able to achieve, and or what we hope that we would be aiming for. And then since 2020, there have been a number of states that have added new limits to voting. And again, this is that competing narrative. Is it good for us to have inclusive voting, or isn't it? And so there have been now new limits to drop boxes, new limits to acceptable forms of ID, polling hours, online, same-day voting, student access. But at the same time, some states have been investing in expanding and protecting their voting access. And I am happy, Minnesota passed a number of things that included pre-registering 16 and 17-year-olds, so they're ready to go, and doing reinstatement of rights for people who'd been incarcerated, and looking at ways to strengthen secure and automatic voter registration. So a number of things that were implemented that we're enthusiastically going to be watching to see how that improves the health outcomes going forward. But now here's a couple of things that I just want to really focus your attention to. In 2022, so that wasn't the election, you know, the federal election, but in 2022, only 46%, less than half of eligible voters voted. So again, when we look at that policy, those policies are happening at every level. This isn't all just about presidential elections. It's happening in school boards, county boards, city councils, park boards. And so 46% is really not a healthy civic engagement goal. And so I'm very happy that we've gotten that into that voting participation is now prioritized as a health objective. Now, here's something that I feel really, really compelled to share. And that is that when we look at the data, we have learned that healthcare workers themselves, licensed healthcare workers, including physicians, nurses, physician assistants, and dentists, are 12 to 23% less likely to vote than the general public. That's just pretty incredible in my mind. And I don't know if I shared here, but there are 22 million people in the health sector. And I think that probably doesn't include all of us in public health. And if 12 to 23% are voting less than that 46%, we're talking about 8 to 11 million people who are employed in the health sector who have been disconnected from promoting civic health. So this is an opportunity for action for us. Next slide. Next slide. So county health rankings and roadmaps kind of gives us a nice framework to think about this. Civic health includes two kind of buckets, if you think about it. The civic infrastructure, which includes the spaces and the policy environment that creates the opportunity for connection and participation. And then the actual participation that includes the voting and the actual participation. So that civic participation is vital to building the collective power to create the representative democracy that we need for a healthy, thriving community. Next slide. And this is just highlighting again the prioritization of Healthy People 2030, getting that in. Next slide. This is an example. So when you're thinking about how do we show up and create change, we have to think about creating change at every level. So at the organizational level, what can we do? Well, we worked with IPHA and we've worked with a number of affiliates to pass policies that to say voting is actually part of our work. And the same with Sophie and the AMA and the American College of Physicians. They've all passed policies that say promoting inclusive voting, promoting civic participation is part of our work. That's important because I have to say in 2020, when we started to reach out to our partners again, and we kind of got through the voting in the COVID pandemic, people started to be reactive to the accusations that saying the word vote in our professional capacities was partisan. And we can't let that happen. We have to reclaim it as actually a health act. And then we can act, that's organizational. You can create change at your state and local level. You've got a good group of people on this call. How do you join together to take some actions? You can promote policies at your county, at your city, all of those arenas. And we've created and are supporting teams in Minnesota and Michigan and Wisconsin. And each of those teams is also working to get the voting as a health objective into their state health assessments and their state health plans. And that lays the groundwork for you to be able to do it at the county level. So, and then the nonprofit hospital system level, so that we can normalize this as part of our work. So those are the kinds of actions that a coalition like you can actually begin to weigh in on. Let's get this in our state health assessment. Let's get this out there. And at the national level, there's a number of different policy efforts as well. I mentioned the data around, next slide. I mentioned the data around the health professionals. So in 2024, we joined up with Civic Health Alliance Vote and Vote ER to promote voting in the health sector. And we just asked our organizations to encourage again, action next slide, to take as an organization to just say, we're going to encourage our employees and our members to vote. And we're going to, and we're going to provide some resources on how to be sure you register and join in on efforts like this. I know that Anjali will talk more about opportunities at the end of today, and I don't want to take that time, but last slide is really not to forget, health is always on the ballot. And because our health is created in all of our policy arenas. So I so much appreciate you pulling people together for this very important conversation.
Excellent. Thank you so much, Jean. And as I said at the beginning, we will have some time for questions at the end. I see that people are dropping comments and thoughts in the chat, so continue to do that. Great to see that as well. Let me ask Shannon to unmute and to join the conversation. As I said, Shannon is from Vision Leads. She'll tell us a little bit more about what this is, but we wanted to make sure that you also heard what's happening here in Iowa and what we can be doing at all levels, as Jean mentioned, to really think about voting and voter turnout. So Shannon, I'll turn it over to you.
Awesome, thank you. Sorry, my internet went out, so I just switched to my phone. But thanks for having me today. I know that this work is super important and you guys have been doing great work in getting everything communicated across the state. So I'm just happy to be here. But I'll tell you guys a little bit about Vision Leads. So we're an organization, a nonprofit, nonpartisan organization founded by Deidre DeGier. She founded it in 2020 and she's been working the past couple years on recruiting and training folks to run for office. And we had success with that. We had about 21 people registered and enrolled in our training program. And then 5 of them were elected to public office, whether that be school board or, the Iowa House. It was a variety of levels. And we're still doing that work, but Deidre wanted to really focus on voting this cycle, especially since it's such an important presidential election year. So Vision Leads, we're focusing on, similar to like what Jean said, we know that there's a lot of people that aren't voting in Iowa. Overall, we have about a 70% voter turnout, but a lot of the precincts have less than that. So we're focusing right now on precincts in Des Moines, Waterloo, Davenport, and Cedar Rapids that all have 40% or less voter turnout. And ironically, we know that people aren't voting in these areas, and some of the areas have become like food deserts. So we know that these the elections matter because the people that are elected are taking the food out of these areas and the nutrition out of these areas. And that's why we're trying to get folks activated in these communities. So we work with already established community groups to try to adopt a precinct using our Community Connect program. So we go into communities and try to find, whether it be like we're working with a couple NAACP chapters that have teamed up with other local groups, whether it be churches or the League of Women Voters, other nonpartisan groups in the communities. But our main goal is to create that sense of community again and that trust so people do vote. We know that people, like John was saying in the comments, like people just don't know exactly what voting means. If the registration means that they're going to be signed up for phone calls or jury duty, all of that. So Vision Leads is trying to create that sense of community and just get people civically activated again and trusting the system. And we know that this, like the NAACP and the League of Women Voters have been doing this work for over a century. So we are trying to make sure that we are just a support system for the community groups that are adopting the precincts. And ideally, we're trying to get community groups that live in those precincts to adopt, because we want that sense of community. We want to create that bond with people and build that trust again, so people do realize how much their vote counts. I know I've worked on several political campaigns in the past, and one reason I was super excited to be involved with Vision Leads is because we are organizing by precinct. So every precinct is going to look a little bit different on how we get the voters registered and how we get them to the polls, how we get people activated. Because on every campaign I've worked in the past, everything's just kind of painted with a broad brush. And I think that's how we've lost people, and that's how we've forgotten about entire groups of people. I know there was one precinct in Des Moines that we have that the doors hadn't been knocked in 5 or 6 years, which is crazy, and that they have a very low turnout rate. So we're trying to, again, just build that trust and that sense of community. And then there is a perk for the groups that sign on and adopt a precinct. Every organization that adopts a precinct can earn up to $1,600 in compensation. Deidre's been doing a lot of fundraising over the past few years, and she's actually doing more right now too. So we can add eventually we want to add like Storm Lake, Marshalltown, Ottumwa, other communities that we know people aren't super active in. But there is compensation for the groups that do adopt a precinct too. They can earn up to $1,600 if they meet some goals that we've asked them to meet, which are the biggest ones: voter registration and getting people to the polls, but also recruiting volunteers so we can knock those doors and make sure that everybody is being talked to, plus just regular old voter registration and education events, whether it be, and like I said, it's going to be different in every precinct, whether it be at a park, an event in a park, or if we know that there's a laundromat that's has a lot of foot traffic and we know it's busy all the time, like we can set up a table there and get folks registered and just even educated. Like Jeanne was saying, the laws have changed and a lot of people don't realize that. A lot of people don't realize that, especially former felons, that they can vote again, and that, the drop boxes are different this year. So these voter education events are not only to create that sense of community and show up in these places, but to educate voters too, and hopefully get them activated in their civic duty again and participating in democracy. So that's kind of the summary of Vision Leads, but I like the work with this because we know the parallels and how everything compares with the communities that aren't voting. They're also suffering the most, but the trust isn't there. And so that's what we're trying to do with Vision Leads. And like I said, we want it to be a year-round constant organizing program. So these groups they are already active and they're already showing up, and we just need to keep going to the people and showing them that they can trust us, that we're not just another campaign asking for a vote and that's going to abandon them after that. We're going to be there and making sure that they are aware, of the changes, of the policies, of the people that they're electing, and that they are participating in democracy. And like I said, we are nonpartisan, so we don't really talk about specific candidates, but we do get questions about policies because everything is political, even down to where your grocery store is in your community. So we do talk about that kind of stuff, but we kind of just try to direct people to doing their own research as well, giving them candidate information for both sides, or stances on different topics on both sides. But the biggest thing is creating that sense of community and just building that trust again amongst people so we can get these voters turned out and then create a better life for them too, just empower them that way. Do you guys have any questions for me?
Thank you, Shannon. Yes, so if you have questions for Shannon or for Jeanne, again, feel free to drop them in the chat. Just a couple things I wanted to kind of follow up on that both Jeanne and Shannon talked about. We've talked a lot, or both of you talked about sort of big P policy, right? About like laws that are in effect that allow us or don't allow us to vote, or set up barriers maybe for certain groups and so on. And I just wanted to mention, and I think Jeanne was talking about like organizational policies and so on. Even in our own organizations that we work in, thinking about like what kind of policies are in place that allow people to take time off to go and vote, or can we invite the League of Women Voters in to do a voter registration kind of event, or can we partner to do that in our organization? We often think, oh, well, voting is a private thing and we can't do something like that. But remember, this session, everything that we're going to be providing is very much nonpartisan. We're not telling people how to vote, right? Or who to vote for. Rather, we want people to exercise their right to vote and to exercise their power, as Jeanne mentioned, right? And some of it is, how do we help each other do that? So thinking about the policies that we can be doing in our own organizations, and thinking about, making a plan and making sure we know where we're supposed to go, and so on. The other thing I think is, Shannon, you mentioned knocking doors, which I find extremely scary. But I'll say there isn't just one thing to do, right? Like there's a lot that you can do, right down to talking to your family, talking to your friends, talking to your neighbors. Again, these don't have to be like huge conversations about a particular issue, but rather it's important to vote. why it's important to vote, how it impacts the health of the communities that we live in, and then how are we going to make sure that people can vote. So thank you both to Jeanne and Shannon for your presentations. Let me open up the chat and see what we have. Yeah, and to Deborah's point about, make sure that you kind of check out your local, the Secretary of State, the local auditor, your local elections, so that you know what's happening, what the dates are, when things open, what needs to happen, so that you're ready to go when it's time to do that. All right, so let's see, Kim, if you're available to throw open that poll. So we have a couple poll questions. Now, this is a public health audience, so these might be very basic questions, but we don't want to make any assumptions. So I think that Kim is going to open the poll. Great. So just two questions I think we have today. How do you usually vote? And this is anonymous, so your name is not tied to this. Be honest. How do you usually vote? All right. And then I think we have a second question. I think our second question
Yeah.
is
Yeah, I can do that after everyone finishes this.
perfect. All right.
We're at 83%, so I'm going to go ahead and end it.
All right, good, thank you. So we have a good number that vote on election day at the polls or go and vote early at the polls. 20% vote by mail, excellent, okay. That sounds good. What do we have next? Oops, close that. I'm so glad I have Kim in the background. Cool.
Okay, are you ready for me to
Yep, go
go to
ahead.
the next one? Okay,
Sure.
hold on just a second. And there we go.
All right, so we do have a call to action. This is the first part of that. So now that you've learned a little bit, listen to, the connection between civic health and health outcomes, so voting and health outcomes, who's one person you're going to talk to about the importance of voting and having a plan for voting this November 5th? You can be specific, you can be more general, but who do you plan to talk to about getting out to vote and being involved? As you're doing that, I'm going to just pull up our last slides here. All right. The last thing that I just want to put up in front of you, and Jeanne shared this, this is part of the voter work that people can make a commitment. So the call to action here is around making a pledge, right? Making a commitment for what can you do at whatever level and to whatever capacity you feel comfortable doing. So the first, and you can see there's a QR code here on these slides. We'll also send out this information to everybody after this session, but you can choose to make an organizational commitment. So whether your organization wants to sign up to commit to strengthening democracy by encouraging voter participation, in your organization, you can do that. You can see, as Jeanne mentioned earlier, the number of organizations that have signed up to do this, and our very own Iowa Public Health Association is one of these organizations that has made this pledge. But there's also an individual commitment pledge that you can make. And so here, thinking to yourself, right? We know in public health, making a plan is important to changing our behavior. So here, making that commitment, holding yourself accountable for how you can further voting and further your involvement and participation, and so on. So again, you can go to this QR code and fill out an individual commitment around your voting. All right, so I'll open it up. We have a few minutes here at the end for questions. Ben, I see that you have raised your hand, so feel free to unmute and go ahead and ask your question.
Yeah, thank you so much. I don't know that it's a question. I just wanted to kind of hop in and say during this relevant conversation that Iowa's DD Council has actually opened up some grants up to $1,500 for each recipient for organizations and groups that might then highlight disabled voters in that space. And I know that you frequently see me in here kind of talking about that, connecting disabilities with public health. And I think that this is a really important opportunity that groups across the state might be able to take advantage of. And it doesn't have to be groups that are really formal or things like that. You could just kind of be loosely organized with that focus being individuals with disabilities. And to kind of latch on to other points made before me, it seems as though that during this last election cycle in 2022, if individuals with disabilities voted at the same rate as the general population did, there would have been an additional 2 million votes out there. And so if across the state in these smaller communities, we're able to kind of help individuals with disabilities understand their power as voters, and again, ask the DD Council for these grants, they really want to get them out there and have people really take action and empower that community. So I'll post the link here in the chat, but please reach out to myself and I can connect you if you have any questions about grants and things like that with the DD Council. They're a great group.
Thank you so much, Ben. That's excellent. Yeah, and I think that really helps us think about, what are the groups that we should reach out to and not to forget and not to think about, oh, well, here are the groups or here are the counties or something that we usually think about. So I appreciate that and thank you for the link. All right, other questions or comments? Any examples of what you're doing or things that you're seeing maybe in your community that you want to share?
Hi, Anjali, it's Arlene.
Hi,
Hey,
Arlene.
I put a sort of a question at the very beginning. I'm with the League of Women Voters, and matter of fact, we're having our Pride celebration up here in Waterloo on Saturday. So we're going to have our booth there for sure to try to encourage people to vote or to register. We've done a couple of other activities, that kind of thing. One of the ideas that I just found out about from a friend of mine is postcard sending. So that's another idea to get, from, I guess, I don't know where you get the list, but, to actually just do a postcard party and, do it in your house. You write out the postcards and you send them. And, and that's something that not everybody thinks about. I've done door knocking in the past and I've done phone calling in the past, but that's a different way. And, with all the crazy crap mail that we get, sometimes it's nice to get a written kind of little postcard from somebody, encouraging, hey, have you registered to vote? That's important. So anything we can do, I think, I don't know, I just feel like the dynamics and the momentum this year is positive. I was at an event, I don't know, a couple of weeks ago up here at our People's Clinic. They had a big event for lots of folks, and I think I talked to over 55 people just to ask them, have you registered to vote? And I got at least 3 or 4 people to register to vote out of that. So it's really simple.
No, Arlene, thank you so much for mentioning the postcards. Lena and I have been talking about that sort of in our, personal work lives. Absolutely. So there are different groups out there, and some of them are partisan groups that do the postcard thing. We are definitely looking at identifying some nonpartisan postcard opportunities. So I know somebody on this meeting is with the League of Women Voters. If you have a resource, we want to hear about it because we would love to be able to sponsor some postcard parties around the state. Exactly. Get your friends, ask them to invite somebody or bring somebody with them, eat some snacks, fill out some postcards. And yeah, just that novelty of getting something handwritten in the mail, that is pretty cool. So good idea. What else? What are some other ideas, or what are some other groups that you think we could partner with? As I said earlier, we really hope that, now we're focusing on voting. We'll be focusing on voting through November 5th. So you will hear from us again for other opportunities for these kinds of sessions, but we want to do things all year long. It's not just, for voting day. So if you have some ideas, we want to hear about them. Feel free to drop them in the chat. You can contact any of us, at any time.
So, my name is John Olson, and I'm with the League of Women Voters of Metro Des Moines. And we are partnering with Vision Leads and have adopted a precinct, one of those precincts that has one of the lowest turnouts of any precinct, and haven't had doors knocked, except for like one school board candidate who actually lives in the district. Nobody else has door knocked there for several years, many years. And so trying to re-engage them in civic engagement. And, door knocking, it doesn't have to be scary. There is training. And we also, what we plan to do is to have chauffeurs. So, let people out on one block, and, the car will follow along and then take you, once you're done with that block, take you to the next block and the next block. And, sometimes the houses, because we're targeting non-registered voters and infrequent voters. So there could be several doors in between. So not to wear anybody out. So if anybody would like to help us out and be willing to do that, we would be excited to have you join us. So you can either contact Shannon, myself, or Christy Gherkin. So
perfect. Thank you, John. And thank you for saying that it's not scary. I should have followed up with that. I mean, it's scary in the beginning, but once you start doing it, it's not as scary. And the thing is, I think it has an impact on people when they see like real people taking their time and wanting to talk to them and wanting to be involved. So
I mean, I would expect that public health workers are very good at conversation, with people who haven't had the best of luck in life and in tough circumstances.
Yeah, that's true. And that's true, especially at the county level where, people are very engaged with. So people at the county health department live in their communities and know the people that they work with. So I appreciate that. All right, as we only have a few minutes left, I just want to make sure to say thank you to Jeanne and Shannon for being here with us today and sharing your expertise. Thank you to all of you that were able to attend and share your lunchtime with us. The Iowa Public Health Association Education Committee is excited to host the 24-25 season. So as I said earlier, the regular schedule resumes next month on September 19th, when IPHA members attending the APHA annual meeting in October will give a preview of what to expect. You can register for the Lunch and Learn series on the IPHA website. We're also always looking for potential topics for future sessions. So if you have some ideas, you can email the IPHA staff, There's contact information on the IPHA website. Just, you know, find the website, bookmark it. Lots of good information there and opportunities. I'll end by saying that IPHA is your public health association. We're made up of members across the state who work in public health and public health adjacent agencies and organizations. So as we just learned, participation and engagement are important. If you are not yet a member, it's not too late. Learn more about how to join this great organization, again, on the IPHA website. And while you're there, please consider making a donation to keep our work as the independent voice for public health in Iowa strong. As I mentioned earlier, recordings of all of our Lunch and Learns will be archived on the Iowa Public Health Association YouTube channel. And you might find some other webinars there that you might have missed and so on. The last thing that I'll say, and thank you for Deborah, I think who put it in the chat, but we do a short evaluation at the end of each of our seminars. The link is in the chat, so please take a few minutes to complete that. Thank you to everybody that joined. We'll see you next month. And if you have ideas, if you want to get involved, if you want to adopt a precinct, reach out. Let's see what we can do together. Thanks everybody for being here.
Thank you all.